Dr. Evan Plys. He is an assistant professor of psychiatry and a licensed clinical psychologist at the University of Colorado Anschutz Medical Campus. He specializes in helping individuals, care partners, and families manage emotional challenges associated with a Parkinson's diagnosis. Dr. Plys will be presenting on stress, emotions, and PD. So welcome.
Thanks so much. Nothing is more welcoming than seeing how well everyone in the audience can punch. So we'll see how. So my name's Evan. I'm a licensed clinical psychologist, and I work specifically with older adults and work with folks and families who are managing age-related illnesses. And as we know, and also wonderful synergy with the previous speaker, emotions are part of this journey and are a very important part of this journey. And today we'll talk about what some of those emotions look like and how to manage them. And I'm very particular about using the term manage emotions instead of treat or get rid of, as we'll see a little bit later. I was actually inspired listening to our previous speaker about a patient I had recently, and I wanted to share her story. She wasn't living with a Parkinson's diagnosis, but she was someone I saw in palliative care, and she had multiple chronic conditions and was towards the end of her life, and she was quite aware of that. She had horrific trauma throughout her whole adult life, and it really shaped her experience as a human. And I remember her describing that trauma like she was at an airport with all of this luggage, and she was just waiting to get rid of that baggage so she could live her life, so she could get on that plane and do the things that she wanted to do in her life. And she said her whole adulthood was pretty much spent in front of that airport holding on to these bags. People are coming and going, flights are taking off, landing, and there she is just standing there. And over the course of our work together, she said that she learned that she could go into that airport with those bags. And I think that's just a great example of the yes and. Yes, I have these bags and I can still go into the airport. And it takes different shapes. Some emotional challenges you can check. They can be out of sight, out of mind for a little bit, and they resurface later. Some emotional challenges, you put in the seat in front of you, they're always kind of there within sight, but they don't really impact your behaviors. Some are, you have them on your lap. They're right there. They're always around, and you're still taking that flight. And I think that was just a beautiful way of putting how you cope with some of these challenging emotions. So why are we talking about emotions here at the Parkinson's Association? I'm sure this is not anything new to a lot of you, but again, emotions are part of this illness journey. And particularly when we're talking about a Parkinson's diagnosis, clinically elevated emotional distress really co-occurs a lot. So in big research samples, up to 50% of folks coming in with a Parkinson's diagnosis report clinical levels of depression. So not periodic sadness, this is clinical depression. 1 in 2, that's a very high number. 40% of folks report clinical levels of anxiety, again, very high. And I think a lot of times we underreport some of these symptoms. So there are studies that show rates even higher than this. Mental health is part of overall wellness, and that really shouldn't come as a shock for again this audience. But in the context of living with a Parkinson's diagnosis, when this clinical distress, when this emotional distress goes untreated, it can relate to physical health consequences. So folks with unmanaged depression, anxiety, we see a more rapid decline in physical and cognitive function. We also see poorer overall quality of life. We see more motor symptoms come up: freezing, dyskinesia, tremors. I put an asterisk there because there are some studies that haven't shown a link between stress and those types of motor symptoms. I can just say anecdotally from my experience, I think when folks have high periods of emotional distress, a lot of them will report more frequent symptoms like freezing and tremors. This is also, emotional distress. Obviously, all of these symptoms I would say are not contained to the individual, but I think especially emotional distress has a pretty big impact on families and care partners. For the care partners here today, I work with a lot of folks who really struggle with the emotional symptoms that their loved one is having. With physical symptoms, we learn from it, we try to manage it the best we can, and I think people kind of give themselves a break when it doesn't go as well as they hoped, and they learn from it. But with these emotional symptoms, the ones that you can't see, I see a lot of blaming of family members, like I should be able to help the person with this. And it's really distressing for, again, the family when these symptoms go unmanaged. Now, the good news is things like depression, anxiety in the context of a Parkinson's diagnosis, very treatable. So we have big clinical trials that show antidepressants work really well for clinical depression. We see moderate efficacy. And you might not be impressed by the moderate term, but when we're dealing with mental health, there's so much variability that moderate is actually really, really good. We also had non-pharmacological treatments, which is what I do with people living with diagnosis and their family members. We have less research, so we don't have these big meta-analysis studies where we can, say the effect size of things. But pretty consistently, we see significant improvements in depression, anxiety, particularly with cognitive behavioral therapy. So the recommendation there is some combination of both pharmacological treatments and therapy usually is the biggest bang for your buck for clinical depression and anxiety. Now, this is a human body, and things like depression, anxiety, and just that stress, that overwhelming feeling show up both mentally, emotionally, and physiologically. So I'm wondering, when you're particularly like that overwhelmed emotional stress, how do you know when you're stressed? Like, what do you know? What are the symptoms you notice come up for you when you're stressed? Muscle tightness, yeah. What else? Tremors, fatigue, yeah. Dry mouth, that's a good one. That's often overlooked, but definitely a symptom. What else? Sweating, yeah. Uh-huh. Shallow breathing, yep. You're hitting on all of them. So usually the ones that we notice the most are that muscle tension, increased heart rate, breathing, increased blood pressure. But as you mentioned, digestion slows down. That's why we get stomach issues, GI issues when we're really stressed. The other thing that happens is our immune system slows down. So this is why like college health centers are packed. It's popping after finals week. Sweating increases. That's why people up here, when they point, you see like all the pit stains. As you mentioned, dry mouth. I very rarely hear that. So that's a really an astute observation. And then there are the mental impacts of stress. So how many people here, when you're like really stressed and overwhelmed, you misplace things or you forget things? A very common experience. And so we say, oh, I'm really stressed out. My attention's not working. Actually, your attention's working really, really well. Your multitasking isn't working. So what happens when we're stressed is we actually hyper focus on what's stressing us out. So if I have 3 appointments and I come home for a quick snack and I don't know where I put my keys, it's not that my attention is failing me. It's that I'm so attentive to those 3 appointments and that stressor that it's really hard to multitask and to switch between those. So our attention actually becomes more focused, but in a singular way. And that's a pretty universal thing that happens when we're stressed. Now, it's going to seem a little weird, but I want everyone to imagine a situation with me. So imagine you're going into the mountains. You just booked a beautiful cabin, secluded in the woods. You're just really excited for this, relaxing weekend. You park the car, you walk up to the cabin, you grab the key to open it, and you look to your right on the porch, and there's this huge grizzly bear just staring at you. Now, I want you to actually take a second and think about what that would feel like to be looking a grizzly bear in the face. Like physiologically, how would you respond to that? Yeah, definitely rapid heartbeat, sweating, screaming. Uh-huh. Can't remember where you put your bear spray. Do focus on the bear. It's pretty similar to this slide, right? I think you'll see a lot of commonalities because what emotional distress is, it's actually our body perceiving a threat in our environment. So whether we're on the phone with Xfinity and we have an appointment in 30 minutes and we've been on hold for 2 hours, or we're staring a grizzly bear in the face, our body doesn't really differentiate that. It's the same physiological response. So stress is actually, from a physiological standpoint, it's a perceived threat in our environment. Now that threat can be something we said, 2 days ago that we're still ruminating on. It can be a progressive diagnosis that we don't know what will happen, what our health will look like in 5 years. Or it can be something immediately in front of us. Our body, again, doesn't differentiate those things. So I think that's really good information for us to have if we're trying to cope with something, to know that we're perceiving a threat. Something in our body is telling us that we're in danger. And that's what's happening when we're stressed out, just as when we're staring a bear in the face. So I often hear when people are, experiencing high levels of emotional distress, like, think positively, right? Think about all the things that are going well for you, what you're grateful for. How many people, and you don't have to with a show of hands, but how many people that's kind of like the default coping with stress? Or when somebody else is stressed out, you tell them, look at the bright side, think positively. No one's willing to admit that. I will say, I've 99% of the people that I see, they say, well, I try to think positively, but sometimes it's hard. I'm like, yeah, it is really hard because your body thinks that it's going to be mauled by a bear. So it's not a really good response in that situation, right? If you're walking in, if you're trying to get into your cabin, there's a grizzly bear right there. Having that mindset of, I am not going to let a bear ruin my vacation, probably not going to work out too well. Now, if the bear says, hey, I'm just here from the homeowners association. We hope you enjoy your weekend. If you need anything, let me know. I'm going to be around the corner. Enjoy your stay. I'll get out of your hair. Then you can probably say, I'm not going to let a bear ruin my vacation, because you've eliminated that threat in your environment. And that's the step that we often leave out in, changing our thinking and being more positive, and in gratitude and, positivity. We leave out the situation that we need to make sure it's okay in order to do that. And so if it's okay, I wanted to do an exercise that really targets just that with you. In these periods of high distress, when we're really just feeling all of it, how do we change that mindset in a way that appreciates that our body is really thinks that we're in danger? So if everyone could just find a comfortable position in your chair. Make sure your feet are rooted in the ground. Shoulders back. You can close your eyes if you want to. If not, just find a place on the table to fix your stare. And we're just going to start with a couple deep breaths. So we're going to go in through our nose and really feel our stomach fill with air, and then out through our mouth. So another one, in through our nose, out through our mouth. One more time, in through nose, out through mouth. Now I want you to turn your attention to the room, and I want you to just notice 5 different things you can see. So you're just describing them to yourself. Just what does the object look like, the shape? What is the color? How does the light hit it? Just notice and move on to the next with 5 different things in your environment. Now we're going to turn to the sense of touch. I want you to touch 4 different surfaces. Again, we're just describing it. What does it feel like? Is it rough? Is it smooth? Wet? Dry? Hot? Cold? Just notice 4 different surfaces. Now we're going to turn our attention to hearing. Same thing, we're just describing sounds. High pitch, low pitch, loud, soft. It can be my voice, it can be air, it can be ringing in your ears. Just notice 3 things. And now think of 2 things that you're grateful for that are in your life. And finally, 1 thing that you like about yourself, maybe a quality, an attribute that has produced those positive things in your life. Now we're going to end with 1 more deep breath in through your nose and out through your mouth. So that was super simple, maybe 90 seconds. And even if we were to do like the 1 through 10, how stressed are you? If you went from like a 6 to a 5, I would say a 10% decrease for 90 seconds is a good trade. So this is just a quick little exercise to do, but if we kind of break it down and think about what we're actually doing with this exercise, 1, we're targeting both the body and the mind. We're doing that deep breathing. We're kind of changing that circulatory system to be like less in this stress response, more in a relaxed response. But the other thing we're doing is we're really shifting our attention to our immediate environment to make sure that we're not in danger. We can tell our brain, oh, I'm okay, I'm okay, I'm okay, I'm okay. But not like actual empirical knowledge is gonna carry more weight with our brain. So we're manipulating our attention to say, okay, there's no bears around, there's no gas leaks. If I'm smelling, I don't hear anything coming towards me, I'm safe. And now I can shift my thinking, and I can do some of those things that everyone tells us to do that are really hard in those periods of high stress. So just a quick little exercise for that. In the interest of time, what I'm going to do is I want to share with you my favorite thing in psychology is this graph. I think this is the best thing psychology has ever done. So this is a graph of emotions. And I really appreciate the information we got earlier today, because we talked a lot about emotions and how important they are. And a lot of the, other than, that fear of talking about our emotions, or not even developing the language to talk about emotions for a lot of us, there's also this way that we think about emotions, often in a binary. So I'm sad and I want to be not sad. Or also sometimes we say I'm sad but I want to be happy. FYI, sadness and happy not on the same continuum. There's been this whole positive psychology movement in the 90s that we have shown over and over again different predictors of happiness and sadness. 2 different emotions, not on the same continuum. But in general, emotions exist on a continuum. So earlier today, when I started, I said I work on helping people manage their emotions, not get rid of their emotions. Because as far as I know, truly the only way to get rid of an emotion would be, well, I think like a lobotomy would probably be your best bet for that. I am not licensed to do that. In good faith, I cannot give referrals for lobotomies, but I bet if you wanted, if you really, really wanted to, you'd probably find a black market lobotomy. But what would happen, and I do want to warn you, if you go this route, and often when we think of emotions in a binary, that might be the best route for you. It's not isolated. You lose the capacity to feel all emotions. So if you get rid of sadness, if you say, I'm not going to feel sad anymore, then that means you're also not going to have the capacity to feel happiness. So that's a decision you have to make. Personally, I would like to keep all of my emotions and just, try to figure out a way to make them work for me. What I really love about this graph, though, other than kind of dispelling this whole dichotomous way that we talk about emotions a lot of times, is it's rooted in function. So emotions, the issue of emotions is not their presence, it's their function. It's how they're serving us. So the story I told earlier about my patient and with the luggage, with the baggage that she had, it wasn't that she had the baggage, because she still had that when we finished therapy. She still had all those traumas. They didn't go away. It was how she was functioning with them. So she was able to go on that flight. She was able to live her life with that baggage. So it's functional. When we're in those extremes, oftentimes when we complain about when we're, to the right of the far right of this graph, when we're feeling that distress, it's not that we're sad. It's not that we're stressed. It's not that we're worried, that we're angry. It's not that we have the presence of that emotion. It's that the dose of that emotion is not functional. So if there's one thing that you take from this, it's how do we manage emotions is not getting rid of the bad ones and increasing the good ones. It's making all of them experiencing all of them in this range that is functional for us. So thinking of an example of fear and worry, I think that's a really common one that I hear for folks who come in with a diagnosis. Imagine if you come home, sit down at the dinner table with your spouse and say, oh, you know what, I completely forgot. So I went to the neurologist earlier today. Sorry, slipped my mind. I have Parkinson's. I have a Parkinson's diagnosis. Anyway, what were you saying? Probably on the extreme end of that calm, right? An odd response. Also an unhealthy response. So it might be nice to be like carefree, to be without these negative emotions. But what would happen if that was truly your response? We talked about 6 months of follow-up. Here's some referrals. You think you'd follow up? Probably not. You think you'd change any health behaviors? Probably not. You think you'd have discussions, planning for the future? Probably not. We don't want to be too calm. We don't want to be stress-free. Now, I think we can all imagine what the other extreme of that would look like. So we want to be somewhere in the middle. I think actually COVID was a really great example of how to manage and make our anxieties functional. We saw people who were probably under worried, didn't work out too well. We definitely saw people who were probably a little bit exaggerated, didn't work out too well for their mental health. But we didn't want people to not be worried. We don't want you, like, as just thinking about the way our bodies are programmed, these emotions are adaptive. We don't want you to not feel angry, worried, saddened by illness. It's worrisome, it's saddening, it's frustrating. These are emotions that are appropriate given the environment, given what our environment is giving us. And we need to make sure that we're staying in that functional range with those emotions. I think a different way of thinking about this is at this point in the evolution of our species, the traits that we have, the responses that we have are fairly adaptive. Like they're fairly advanced. So we can trust that in a situation when we feel an emotion, it's not inappropriate. Maybe we just need to change the dose to make it more functional. Or if it's uncomfortable, but we can still function, that yes and, that's okay. That's what our body's supposed to do. That's what our brain and our systems are supposed to do in response to what our environment's giving us. Now, I did want to make sure that I talked about a very specific emotion, and that is anger. And particularly for the care partners in the room, I think that for the patients that I see, anger is often like the most distressing emotion. People do not do well with anger. Anger is very much this binary. Like I cannot be angry. For care partners, like I took my loved one 2 hours to get ready, and I'm angry. And how awful am I to be angry because it's not their fault? Well, yeah, it's not their fault, but that's a judgment, and we'll come back to that. For people living with a diagnosis, I don't like the way my spouse is talking to me. They're making me feel less than. I feel like they're treating me like a child, and I'm angry. But it's because they love me. They do so much for me, so I can't be angry with them. Anger is just like every other emotion. It exists on a continuum, and there is a functional range for it. You'll see that the functional range isn't at 0. So we don't want 0 anger. We don't want to be blowing up and like throwing things and what we learned earlier with the punching, like we can leave that here. We don't need to bring that up with the anger, but we do want to have a little bit of anger. And this is what I talk with people about is what is that anger serving you? What is the function behind that anger? Particularly in a relationship, when you think about when you get angry with a spouse, for example, you're asserting your needs. You're saying this behavior is inappropriate because of the needs that I have. I'm not having my needs met. Something needs to change. We need to solve a problem, and I'm angry about that, and it's motivating me to solve that problem. So the folks who come in and they say, I'm angry and I'm an awful person for that because I should not feel anger, I say pretty bluntly, well, if you did feel anger, I'd kind of think you were an awful person. Because if you don't feel anger, you're kind of abandoning the relationship. Relationships are about needs, right? Your needs and your partner's needs. The minute I say anger is no longer part of this relationship because of this circumstance that we're in, that means that this relationship is no longer something that I get needs met in. And that seems like a really not a great relationship, right? So I bring that up because I don't hear that talked about enough. That anger, of all of the emotions we talk about sadness, we talk about fear, we talk about, happiness and stuff like that. Anger is often glossed over. And I think anger is such an important part of any illness journey. And it's one that I think is stigmatized more than even sadness. So be angry, assert your needs, because when that anger comes up, what that means is I am willing to problem solve with this person. And I, am in this circumstance and I deserve to have my needs met, and I will continue to have my needs met because this is a relationship and a partnership. And so again, stay angry. Stay angry, my friends. And I think at this point we have some time for questions if anyone has them.
We do. We've got two moderators in the office, good God, in the conference room. So we'll start. I saw a hand up over there.
Cognitive slide that you had up.
Oh, the one that I went over? How do I go back? Oh, there we go. It's got a mind of its own. I'm not. Is it this one? Okay. Oh, it stopped on it. Perfect. I knew how many clicks. So yeah, so this is a graphic of cognitive behavioral therapy, which it has the most evidence as far as non-pharmacological interventions for depression, anxiety in the context of Parkinson's. As far as I know, this is actually the only study that I've come across that really takes the model and has it specifically for folks living with a Parkinson's diagnosis. And I mean, would it be helpful to just really briefly talk through it, or? Okay. So as you can probably get from the title, cognitive behavioral therapy is really about the thoughts that we have. How do we adjust and make our thoughts more productive for us? And also, how do we make sure that we're engaging in behaviors that are more likely to increase positive events and decrease negative ones? So if you notice in this slide, particularly in the context of living with a Parkinson's diagnosis, it really focuses on those cognitions, the thoughts that we have. Today we talk a lot about behaviors today. So you're learning some great skills of how do I engage behaviorally. Sometimes those thoughts get in the way of that though, and sometimes those thoughts are really uncomfortable for us to have. And so this really pinpoints these three types of thinking patterns that relate to depression and anxiety in the context of living with a Parkinson's diagnosis. So one is overgeneralization. So this is, one event happens and you overgeneralize. I had to leave this event early because I was in a lot of pain. I can never go to another event again. Taking an isolated incident, overgeneralizing, that's a thinking pattern that will shape the way that we feel and ultimately the way that we act. If I think that I can no longer go to an event, I'm probably not going to seek out going to an event. Catastrophizing is just what it sounds like, taking the worst possible scenario. I have this diagnosis. I will 100% lose all function, end up in a nursing home. Whatever your biggest fear is, that becomes the catastrophizing of this is absolutely going to happen. And then rumination is just kind of like a pattern of thinking about the same thing over and over and over again, replaying this over and over and over again. So these are the thinking patterns that really can lead to things like depression, anxiety. The way to combat these patterns is to see them for what they are, which is flawed ways of thinking. It can sound the first time I think the first time people kind of challenge these thoughts, it can sound a bit contrite of, really, you can't go to an event ever? It sounds a little sassy, but it's true. Like, really, you can't go to an event ever? Like, that's not true. So it's all about the accuracy. There's reasons why our brain thinks this way. You're not a flawed or uneducated person for falling into these thinking patterns. They make sense. Our brain makes shortcuts. It's not unreasonable to say, oh, I had to leave this event, So maybe I'm never going to be able to go to an event again. There's so many contributing factors, like, oh, I didn't sleep well the night before. Like these chairs were, built in a way that, was aggravating some of my, pain areas. We don't tend to think about those contextual factors. Our brain makes these shortcuts, and that's kind of what leads to these types of thinking. So, when you're challenging that, and when you're saying, well, is it really, that's essentially just bringing in all of the evidence that you have, knowing that our brain is going to trim the fat. It's going to try to get to A to B in the quickest way possible. And a lot of times when we go to A to B, you can have a job done well or a job done quick. Your brain's no exception.
Thank you. We've got a question in the back of the room over here. Oh, go ahead. Do yours. I'm sorry, I didn't see you. Go ahead, Alan. Do yours first.
Thank you very much, Dr. Evans. This is great information. That overgeneralization that I think is great. A lot of people wake up rigid or very with a lot of muscle pain. And one of the things that I've learned is that, even if you wake up with a lot of muscle pain, I've always say, it's gonna be a beautiful day. And that changes my mood. And that annoys a lot of people too, because you're happy, but it's kind of thing when I think, and that's very great what you do. What are the things we can do to make sure that we're not, thinking that way? When people are diagnosed with Parkinson, they think that this is what's going to happen, and there's 100 different people who are different. So I would say stay in your own lane and don't compare yourself with anybody else. You can be good one day, bad one day, but never compare yourself. What are some of the other, and that's what my wife told me, which is not here, she's working. But what are some of the other examples that we can do to improve our mind, to make it better, even if we wake up a little bit with a lot of muscle pain?
Yeah, I love that, and thank you for that's just like an amazing and a hard thing to do to counteract some of those negative thoughts with saying like, and today's a great day. Again, a great way of yes-anding. I think from my experience, a lot of times there's resistance to, again, like the positive thinking, because the reality is you're waking up with, rigidity, you're waking up with pain that is uncomfortable. Like it's not everything's great, the sky's the limit. That's uncomfortable, and sometimes it's very limiting. And so I think that, the way to combat the thinking spiral that keeps you in bed, that makes it seem like, oh, like I can't do anything, these overgeneralizations, is holding yourself accountable to be accurate. So again, we're abandoning the good, bad, positive, negative, feel good, feel bad way of thinking, because that's subjective, right? Like the way you feel, whether a thought's good or bad is subjective, and there is variability. Everyone is different. Everyone has different thresholds of what they're willing or what they're able to take on. So I would say be as factual as possible. So I am in pain right now, and I'm having the thought that I might not be able to go to the grocery store. Is that true? And that way of thinking kind of takes the emotion out of it. It takes the, oh, this is so unfair. It takes the, I don't want to tolerate this discomfort. It takes that out of it, and it just, stick to the facts. So long-winded way of saying the way that I would recommend to combat those thinking patterns is to stick to the facts, man. Like what is true, what is in front of you, and think of it as accurate versus not accurate. Take emotion out of it.
Okay, thank you. One last question.
I'm just curious about on your diagram, the fatigue factor. And I'd never thought of fatigue as an emotion, but can you talk about fatigue just a bit?
Yeah.
And how to move that into a more positive state?
Yeah, fatigue's tough. Is that on this graphic, or which one was that? Oh, the stress level. Oh, yeah, sorry. We'll get there. So, when we, I'm sure we all have the experience of being overwhelmed with emotions, and then we're just like, I am so tired. You know, I'm fatigued. So this is a consequence of being in that distress range. So when we notice that we're feeling really overwhelmed with these emotions, that's when we get really tired. And that's just an indicator to us that we're entering that stage where we're no longer, our emotions are no longer functioning well for us. So I would say fatigue is more of a consequence. You know, it comes with that anxiety, it comes with that depression, it comes with that overwhelming feeling. And when you start to notice that, well, one of the more productive things that I've had with patients is when you start to have that thought of, oh, I know what I need to do, but I can't do it because I'm so tired. Like, I know what'll take me to the functional range, but I just can't because I'm tired. I think that's the time, take a step back, to pause, and to be very, you know, again, factual about, you know, what can I do in this situation, and notice that, you know, I am in a place right now where my emotions are not serving me. And is there something I can do to bring myself back to that functional range? You may still feel fatigued, more fatigued than normal. And you want to get yourself into a place where, even with that fatigue, again, the yes and, I'm fatigued and because of these emotions, and I can still be functional with them.
Okay, thank you so much, Dr. Plys.
Thank you.